primary care into behavioral health and behavioral health into primary care. So the TA Center is serving a national audience, and then they're also providing specific TA to both the grantees I just talked about and also to the grantees that HRSA funds. So there's a number of things that the TA Center we're expecting them to do. I'm not going to read through these, but you can see that this is a very well-funded TA Center. It's co-funded again by SAMHSA, HRSA, and again we received some money from the Secretary's Prevention Trust Fund, which comes from the Affordable Care Act. And so there are a couple main areas that the TA Center is going to focus on. Knowledge development and dissemination, and these are things that any good TA Center would focus on, I should say. Also knowledge application, so that's really where the training and TA part comes in. The policy analysis, prevention and health promotion, and workforce development. And I'm sorry, I was remiss in saying that this cooperative agreement has gone to the National Council for Community Behavioral Health Care. And Kathy Reynolds, who introduced me on today's call, is actually the lead for that TA Center. So that's been a really nice partnership so far. And again, the audience is our SAMHSA grantees, HRSA grantees, and the general public. So the last piece that I'm going to talk about just very briefly is the Affordable Care Act in Section 2703. And that is technically the state option to provide health homes for enrollees with chronic conditions. And that is basically a fancy way of saying the person-centered health home. Now, the goal of this project is really to enhance integration and coordination of both primary, acute, behavioral health, and long-term services for folks with chronic illnesses. And so the health home is really, the focus of this is to provide an opportunity so that there's a person-centered system of care that achieves ultimately improved outcomes, and so that there's value added for the state Medicaid programs. And this program is being coordinated per the legislation by the Centers for Medicaid and Medicare, I should say. So there's a couple discrete populations of people who are being served, folks who are on Medicaid, who have chronic conditions, and they fall into one of these three areas. Either they have two chronic conditions, they have a chronic condition and they're at risk for a second chronic condition, or they have a serious and persistent mental health condition. And this is all laid out in the legislation, the Affordable Care Act legislation. And these chronic conditions, you can see these can include a mental health disorder, a substance use disorder, asthma, diabetes, heart disease, or being overweight. And the Secretary, it's at the Secretary's discretion to add to this list of chronic conditions as she sees fit. So there's a couple of required services that these health homes have to provide. And so the states, as they're preparing their SPAs or their state plan amendments, they have to show how these required services are being provided